I'm going to present just a very short presentation, a few slides from Dr. Robert Battmer. Dr. Battmer is an obstetrician and gynecologist surgeon. He has a clinic in Prairie Village, Kansas, and has practiced medicine for over 45 years. And this is mostly about practical use and applications with his patients of our SCD essential probiotics. So Dr. Battmer has given us a number of reports. I'm just going to provide the basic overview of the use of our products and their feedback by some of his patients. Many patients with some type of intestinal disorder ranging from reflux esophagitis, where the acid reflux up into the lower esophagus causes pain, and gastritis with pain, inflammation of the lining of the stomach, and all stages of inflammatory bowel disease, from mild irritation to incapacitating cramping and bleeding, up to and including ulcerative colitis, have responded positively to all three products: SCD Essential Probiotics, SCD Extra Immunity, and SCD Herbal Probiotics. There's decreased risk in adults, generally found reduction in the following after the use of SCD Essential Probiotics: recurrent colon and bladder cancer with probiotics, perioperative infections in abdominal surgery with probiotics in adults. Dr. Battmer follows up with probiotics for patients who have been on antibiotics, which appears to be beneficial in restoring intestinal health. Chronic infections including sinusitis, inflammation of the sinuses, vaginitis, inflammation of the vagina, and cystitis, inflammation of the urinary bladder, which have been problem conditions with many of Dr. Battmer's patients. They've responded to probiotics. Probiotics represent one of the first lines of treatment Dr. Battmer uses for these conditions. So, a few specific cases. Patient Mary had recurrent vaginitis. Essential probiotics kept the infection from returning, which was a continuing problem for her. Patient Tom had chronic sinusitis and had dealt with the condition with repeated doses of antibiotics. He started taking SCD Extra Immunity and no longer has chronic bouts of this condition. Patient Susan had an irritable bowel condition by which she experienced intermittent bouts of diarrhea and constipation. The patient was unable to get the condition resolved until essential probiotics, along with increased fiber intake, resolved this condition. A patient, Madeline, has greatly benefited from SCD Extra Immunity with her long-standing battle with chronic fatigue and fibromyalgia. Patient Jeremy, after taking this SCD Essential Probiotics for a little more than a month, his chronic toenail fungus and athlete's foot has been resolved. The athlete's foot seems completely gone and the toenail fungus is clearing up. He had tried lots of remedies for this foot over the past 10 years. Unlike many other probiotics he has taken, this is not at all constipating. It has a pleasant taste once you get used to it. Patient Jason tried multiple probiotics and was referred to SCD Essential Probiotics. His acid reflux had gotten so bad it was really creating daily problems in his life. None of the over-the-counter remedies worked for him. Within the first month of using the product, his reflux was almost completely gone. After using essential probiotics for almost 4 months, he has no discomfort issues anymore. Essential probiotics has totally changed his condition. It changed his life by relieving discomfort and allowing him to enjoy the foods and drinks he loves most. One notable, or two scientific studies that are noted here. One is the conclusion is that breast cancer and colorectal cancer patients receiving chemotherapy had markedly less diarrhea when taking probiotics. And radiation-induced diarrhea was also reduced with probiotics. So once again, I just want to review some of the mechanisms and uses. So probiotics are, in the scientific literature, understood to work by way of these points: adherence and subsequent stimulation of gut immune system, maintain normal macrophage function, production of antimicrobial factors, provide favorable environment for growth of other beneficial bacteria, and production of short-chain fatty acids with anti-inflammatory properties. Uses found in scientific literature are infectious diarrhea, antibiotic-associated diarrhea, irritable bowel disease, necrotizing enterocolitis, bacterial vaginosis, irritable bowel syndrome, atopic diseases, immune system enhancement, Helicobacter pylori infections, which cause ulcers in the stomach, dental caries, cavities, radiation-induced diarrhea, cardiovascular risk reduction, constipation, and rheumatoid arthritis. So those are the notes from Dr. Battmer, and I just want to add, this is not from Dr. Battmer, but just my observation. So many of these issues are clearly related to an imbalance in the microbial ecology, or also known as the biome in the patient or in the person, or for that matter in the livestock and the pets. There's a common theme here, which is when that balance is lost, some undesirable microbe gets in high population, like, for example, a yeast infection or a toenail fungal infection. These are symptoms of an imbalance in the microbial ecology of that system. So by applying probiotics and reestablishing diversity, reestablishing the presence of beneficial microorganisms, then that population of the disease-causing or the disease-causing pathogen will be reduced. This is the common theme throughout a lot of the pathogen control results that we see. And of course, one of the things also mentioned here several times was the antibiotics causing diarrhea and causing these infection problems. So one of the challenges with antibiotics is that, it's not, the antibiotic doesn't just kill the disease organism or the pathogen. It wipes out much of the microbial diversity. And so when that occurs, then just the opportunistic microorganisms will repopulate, and the likelihood of both diarrhea as well as incidence of pathogen and disease increases significantly. So it is becoming very common practice now in the United States in the medical community to recommend probiotics along with or immediately after taking antibiotics. And that's all I have for now. Thank you.